There are several times along the cancer diagnosis, cancer treatment, and cancer survivorship continuum that tend to be the most stressful for most people. The first for most is the time between diagnosis and first treatment. Surprisingly, though, the second most common stressful time, and the one we are talking about today, is the time of treatment completion and the transition into cancer survivorship. This one catches people off guard. You've rung the bell, so exhaustingly and blissfully happy to be done with surgery, chemotherapy, and radiation. But then you realize when it's over, it's not always necessarily over. You eventually realize you may not neatly fit back into your previous world. You may still face a wall of weakness, side effects, and uncertainty. And then those new fears can start to creep in. You may also feel like your favorite doctors and nurses are now on the other side of a door that just closed behind you. You're supposed to go back to normal, but nothing feels normal, and everyone around you thinks you should be just fine. So there you stand, dumped off the cancer conveyor belt with no roadmap. Welcome to the crickets of early cancer survivorship. This is what we're talking about today. Thank you for being here for this conversation. Our guest today on the show is nurse practitioner and cancer survivor specialist, Michelle Kirschner. With more than 30 years in the field, Michelle was the director of the University of Cincinnati Cancer Center Survivorship and Cognitive Programs, and recently served on the Biden Moonshot Expert Panel for the development of national survivorship standards. Whether you are podcast watching or listening, I appreciate you being here. I'm cancer physical therapist, Dr. Leslie Waltke. Please hang around until after the show to learn how you and I can engage directly in my incredible cancer survivor membership group, Recovery Room Plus. This is the Recovery Room podcast, discussing all things cancer recovery, bringing you the experts' accuracy, understanding, and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. The crickets of early cancer survivorship, navigating the unseen. Michelle, welcome to the show. Good to have you.
Thanks so much. I'm so glad to be here today.
Fabulous. So, you and I both work in oncology, so we're used to just seeing people just fight to get through treatment. They're struggling day to day, the week to week, the appointments and the chemo, the surgery, the radiation. People are so focused on just getting through. And then they get dumped off the conveyor belt. Boom, you're done. Congratulations. And, their hair starts to grow back and the incisions heal and the burns heal and they look fine. So people assume that you're fine. And we know, you and I know, and physicians and nurses know that you're probably not fine.
Yeah, I think that when individuals are in cancer treatment, they feel like they have so much support. They just have their treatment team that they just see regularly, and really their friends and family, they really are just there for them.
Yeah.
And I think one of the first things that happens that they're not expecting is this kind of disconnection when, their treatment team says, well, see you in 3 months. And friends and family are kind of like, hey, you made it through and like, let's celebrate, ring that bell and then move on. And then suddenly, individuals realize that, wow, there's actually a whole new set of challenges that nobody told them about.
Yeah.
And so that's just so disorienting.
Yes,
So,
disoriented is a very, very good word.
mhm.
Yeah, and then you're not only disoriented, you're, granted, it's cancer is kind of a red carpet. Like you will do this, you will do this, you will do this next. You're going to go here, you're going to do this, you're going to take this pill, you're going to do this. I mean, it's a very step-by-step. That's a shitty red carpet, but it's kind of a red carpet. This is your path. And then all of a sudden, you're disoriented and that path is gone.
Right. And the conveyor belt, I call it the conveyor belt.
Yeah.
And often, cancer centers will have nurse navigators who will help you get to the next step. And the problem is that at the end of treatment, I think a lot of places are not really good at hooking you up with the team and the resources to deal with that part of your survivorship journey, the post-treatment. And so that's, it's not just the disorientation, but it's also you're almost put in control of coming up with the plan.
Yes. And when I train my physical therapists, because your physical therapist should not go away at the end of your cancer treatment, because there's a whole slew of because people are still dealing with side effects. Fatigue is definitely probably not gone. Pain may not be gone. Energy is not normal. Skin nothing's normal, right?
Right.
So I teach my physical therapists, don't don't go away at the end of cancer treatment, because you're going to need to maintain that relationship, because it's just such a tough time for people. It's just such an undiscussed area of cancer care. Let's validate that this is a really, really hard time for people. So let's name the challenges that most people face in early transition period. So we've got physical constraints people are dealing with, the psychological constraints. So again, that disorientation, that fear of, wait a minute, what am I supposed to do now? Where's my people? Isolation, loneliness. People don't quite necessarily understand what they've been through. And I get this, the co-survivor part of it. People are just so desperate for you to be okay. They want you to be okay.
Totally.
And that's nothing offensive. It's just like they've seen you hurt so long. They just want you to be okay.
And people want you to be okay. And so sometimes people actually minimize what's going on because they just want to kind of just reintegrate. And, we know, first of all, it takes a while from treatment-related effects to kind of, for those to go away, such as fatigue and the cognitive impairment. But there's also there's a good portion of individuals, I would say about 30%, a third, that have long-term effects with those types of areas and really need intensive intervention to feel better. And so, it's really important to know, actually, you need to be proactive, in kind of managing some of those things. And those are the things that keep you from like re-engaging with life. When you're tired, you can't be with your friends and family.
Right.
When you're cognitively impaired, you really are having a hard time at work. And so I think a lot of survivors, what I hear about is they come home, if they, once they go back to work, and they come and they just lay on the couch and they just kind of have nothing left. And so that's really, that's the goal, is that there's ways to overcome that. It's not, you don't have to accept it. That's really
so.
And
again, I think that's where the isolation and depression can kind of kick in. And then there's a whole new set of fears, like, well, how am I supposed to know if there's something wrong with me? How am I supposed to know if my cancer's come back? How am I supposed to know how to do how am I supposed to know how to take care of myself?
Right. And that, anxiety, I think it really hits when you have your, the first scan, and that we call it scanxiety. It's like suddenly you're like, wow, I mean, that fear is really there. And so understanding that underlying stress actually really, it's something we want you to like look at and understand and have your toolkit on how, how I can really reduce it, because if it just stays there constantly, it's really, it can really wear away and make just things harder in general.
Yeah. And I think people may not realize too, that for a lot of types of cancers, people that have HER2 positive cancers, or people that have hormone related cancers, like guys with prostate cancer, women with breast cancer, they're on medications for years after their treatment is quote unquote done. They're still under treatment. And some of those treatments have no impact on you. Some of them can make you really feel crummy and have, significant side effects. But you have normal hair, so people think you're fine. So I think cancer survivorship can include ongoing, underlying treatment as well. That can be really complicated. And some of the side effects will eventually fade with time, but some of them can be permanent, like, the way you look, scars and neuropathy and some of that stuff. So it's just people are carrying a load on their back that other people don't necessarily see.
Yeah, and I don't think we talk a lot about functional impairment after cancer treatment, but there are things that keep you from doing what you want to do during the day, and that's where physical therapy can really be important. So it's really essential that people help you identify the areas that need to be addressed, so that you could be proactive in kind of untangling the issue, so you can get back to what you want to do.
Definitely. So does healthcare drop the ball here, or why is this such a unaddressed area? Certainly it's not the patient's fault. So and I don't know if it's a fault, but what is the problem here?
I think in cancer centers, cancer care in itself is so complex, and a lot of
Mhm.
resources are really put into getting patients through active treatment.
Yeah.
And so, you have the nurse navigators and social workers and all these team members, dietitians that are there. And so, I think, cancer centers, there's only so much that they can do, and oftentimes that survivorship period is really just on the back burner. And
Mhm.
we're trying to raise awareness about the importance of that phase of care. And there are programs that are starting to create resources. So you should definitely, individuals should really look for them because they could be out there, but they're not often just automatically given to you. And
Right.
that's a problem.
So at least this is starting to be addressed by healthcare, correct? We know it's a problem. It's not like we're oblivious to it.
Yeah, I
So
think
there
I think everyone knows. It's
okay.
just, a system. It's like changing a ship. It's
Yeah.
so slow. So I think there is progress, and again, I think there are things out there. So I just think that individuals need to know they need to be in charge of that phase of care a little bit
Right.
more than what they were in their active treatment.
Yeah. Okay. So, give us some tips. How does somebody do that?
So I would say, first of all, again, identify your resources. So, the easiest thing is in the cancer center, just ask, is there a survivorship program? A lot of cancer centers will have a end of treatment survivorship visit. Definitely take them up off on the offer, because
Mhm.
once you have that visit, then you're going to be sitting with a person who really knows what kind of resources are in the cancer center and even in the community, and they can actually be really educated on what are the problems that they have to be looking for. So if that's available, I have had so many individuals who have just refused the survivorship visit because they didn't know what it was.
Yes.
Um,
Yes.
so, and then I would say, look for community or resources locally that really can promote some of the things that will help you. So, you want to really engage in exercise and activity. So, community resources that are available for that, and um, and then also, again, look and really look for other cancer survivors and
Mhm.
network. And then nationally, if you look online, there are some national resources also.
Yeah. Um, and I will always say that hopefully by the time you become a cancer survivor, um, or end your cancer treatment, that you should already have a physical therapist. But if you don't, my goodness, get
Yeah,
one. For sure, get
I
one.
was, I
And
was,
just because technically your cancer treatment is ended, you're certainly not going to be talking to your physician as much, but it doesn't close the door on the social worker, the dietitian, the PT, the nurse practitioner, even the nurse navigator is certainly not, they're going to take your phone call. So I think to encourage people to maintain relationships, or at least have the phone numbers readily available. Boom, boom, boom. How do I get a hold of you if I need something in between now and my first 3-month visit? What do I do? And then I think this is a huge topic that for a whole nother podcast, but we know in cancer care that people need to maintain relationships with their primary care physician,
oh yes,
which people are so busy. They got this doctor, this doctor, this doctor, this doctor. They're like, I haven't seen my PCP in a year, and that person has got to be the leader of your life. So re-engaging or engaging with your primary care physician. Again, if you don't have a primary care physician, get one. If you have a primary care physician that you do not like and you have the opportunity to get a new one, get a new one. You've got to be able to communicate. So re-engaging, and then having open discussions with your practitioners, primary care physician, or any of your oncology practitioners, because people will often say to me, a PT, because we talk about side effects. That's because that's what we do. Is, oh, I don't want to complain. I'm like, you're not complaining. You're
right,
telling me about your symptoms,
right.
right? If
That's true.
you have if your feet are on fire, if you are fatigued, if you have vaginal dryness, if you can't sleep, if you're feeling anxious, if you're depressed, we can't help you unless we know.
Right.
So I over and over what really push people, you're not complaining, you're telling us how you feel, and we can't fix everything. We can't fix everything, unfortunately, but we can't at least help what we don't even know about.
Yeah. And there are treatments, and that's the whole point, is that,
Yeah.
that's why we want to know about these things, because there are, there's research and there are guidelines on the what we should be providing for different types of issues. So, yeah, know that there's help out there. And I would add about the primary care, which I think is an excellent point, is also when you speak with your primary care, just understand their comfort zone with your type of cancer,
Hmm.
because there is a really large variety of knowledge within primary care. And there's actually a specialty now called oncoprimary,
Yep.
where in some places there are primary care physicians who specialize in oncology patients. And I would say for individuals who have had more intensive treatment or have a rare type of cancer,
Yeah.
that you might want to search out those specialists.
Yeah. Yeah. Very good. Okay. Um, so when we're talking about tips, again, identifying your resources, both in the community and within your hospital system. And again, whether you are in a rural hospital or an urban center, your access to resources is probably maybe very different. But again, there's a huge list of online resources, and you definitely take advantage of the survivorship visit. Again, you're right. I think a lot of people don't have no idea what that is, so they don't grab onto it. And I think, again, we're so used to, we know what that is and we know that it's important. We're just like, oh yeah, do this next. And people are like, well, what the hell is that? Because we don't
Right.
explain it, we just don't, we
They
don't teach
don't.
people very well. So
I ask
definitely do that.
I ask every patient who comes to a survivorship visit, and I'm like, "Do you know what we're going to do today?" And no one understands. So,
Yeah.
and it's really hard. You've got individuals have gone through a lot of treatment. They've gone to tons of appointments, and they really just are kind of done with appointments. And
Yeah.
so they don't really understand that maybe this one appointment is the appointment that's going to help you kind of get to the next step.
Yeah. Yeah. It's the transition off the conveyor belt.
Right.
All right. So give us 3 tips you have for people entering this early zone of cancer survivorship.
Okay. So I would say one tip is kind of getting your A team together.
Yep.
Again, and we just talked about that. It's just understanding the resources that you need. So again, a physical therapist, a community, finding a specialist in survivorship. Having those resources, and also mental health providers. It could be a
Mhm.
social worker or someone, because again, this transitional time can be really difficult, and it's great to speak with someone who can kind of help you through it. So I would say, just what we discussed, don't just leave it up to fate, kind of, work on
Yeah.
getting that team together.
Yeah.
I would say the second thing, tip is really, movement is, I call it magic,
Yeah.
and medicine. And so, as you're putting together kind of your plan, make sure that you build in some kind of habit and a resource to help you move again, because a lot of people are afraid to move after
Yeah.
treatment.
Yeah. Yeah.
So that's again, with physical therapy is a great start, and then often they will transition you to some other types of resources.
Yeah.
And then I would just say, kind of resources is just mentors of other, cancer, cancer survivors that had your type of cancer. Connect with them. I've seen some really beautiful communities, and it's just being with people who kind of get it, who know
Yeah.
what's going on. So I
Yeah.
would say
There's a
these
lot of
are,
Facebook groups, right?
yeah, there's Facebook books
Yep.
and the groups, and then there's and then often with like cancer support communities, they'll have a group of kind of like post treatment support classes or groups, and so you can meet people there, and then often a group will just kind of become their own little social
Yeah.
um, group, and they will go out and have coffee and things. So it doesn't have to be so structured, but find those people that could really understand what you're going through.
Yeah. Yeah. And then how should people not manage or cope with their whoever's living in their home, a roommate, a spouse, a partner, a children, a parent? I mean, because yours, how do you communicate your needs and because they're not seen. It's hard to see somebody struggling when somebody's bald, you get it, but when they're not bald, shit still sucks. But what are some communication things that people should, and how do you address that with your co-survivors?
Right. So I really think, again, understanding that being proactive, it's, it letting them know what's going on, the types of symptoms you're having, can just be helpful and just say like, when I get home, I'm so exhausted. So that they kind of can support you in that. Oftentimes, like cognitive symptoms are the ones that are really not
Mm-hmm.
understood. And so really just talking about like, if you're having problems remembering things and people are kind of, treating you in a way that's not supportive, just remind them and say like, this is really hard for me, and this is how you could be supportive. So I think, just talking about these things, and then everybody wants support in a different way. So
Mm-hmm.
really talking about like what things are really helpful for you, and what things are not. And
Yeah.
so sometimes just being, just a cup of tea and just sit with me is great. Some people will say like, actually the type of support I need is I need you to like to really push me to exercise and move because it's hard
Mm-hmm.
for me to do. So again, kind of understand what you need and just communicate it in a very exacting way. So it's not like you don't get frustrated because you don't get the support you want.
Right. Right. Exactly. I think it surprises survivors and it survives the people who love them that cancer recovery doesn't, I mean, technically it maybe starts the first day after your last treatment, but it can minimum 3 months recovery. Usually it takes 6 to 12 months, sometimes 18 months for people to physically recover. And emotionally, it can be at least that or more. So I think that surprises people,
Yeah,
you know?
and I think the experience of cancer changes someone, not in so
Yes,
many ways, like
right.
physically, emotionally, but also even kind of what are my missions and values in life? Things are
Hmm.
reassessed, and so just understanding, like, kind of, okay, who is this new person in front of me, and it can be good sometimes.
Yep.
It can motivate people, and it can really make them appreciate the things that they have. So just understanding you're a different person, and kind of getting understanding that person and what they need, and that's really the
Yeah,
next step.
that's great. All right. So what are your three favorite resources for cancer survivors?
So one resource, and which I can you can really use throughout your cancer journey, but I think it's great to have around even when you're in survivorship. It's an online resource called My Cancer Crew, and it's actually a free app, and it allows you to kind of organize and communicate with your own personal community, so your friends and family, and you can create kind of your requests for like support. So like when you're in treatment, you could talk about meals, transportation, childcare,
Cool.
other things. But then when you're in more post treatment, you can just talk about, hey, everyone, it would be great to get together with everyone or to see someone, or I would love to exercise with a group. So it gives you a really great, efficient way to just communicate with your little support community.
That's wonderful.
Yeah.
Cool. All right.
Yeah.
Number two.
So I would say the next one is probably the National Comprehensive Cancer Network guidelines. These are guidelines that are online, and they actually have patient um, versions of these guidelines. These are the guidelines that your treatment team uses in your
Mhm.
treatment, but there are also guidelines about survivorship there. So if you want to kind of see what is, kind of the recommendations for different treating different survivorship related issues, that's a great way to take a look
Yeah,
at.
that's a great. I hadn't thought of that. That's
Yeah, actually
fantastic.
guideline.
Yeah.
Yeah, I'm
Yeah.
so happy. And then I guess a third one would just be kind of like, again, if you've never connected with like a cancer support community, in some places it's called like Gilda's Place. Each
Hmm.
place has kind of a different name, but I really feel like those communities are especially good for survivors post treatment, because that's where they have like a lot of exercise classes. They'll have
Yeah.
nutritional classes and other things. So that is a great place to start, just to find resources.
So you can find either online or in person in most places around the country cancer support groups or cancer survivor communities that are not necessarily the old traditional support group, because people really shy away from those. I don't want to go sit and listen to people
Yeah,
crab about their feet burning. Nobody wants, most people don't want that.
right.
So you're talking about engaging survivorship community. And again, you need to find what's right for you, whether it's an exercise group, whether it's a dragon boating group, whether it's, I'm a guy and I have breast cancer group, or, I have pelvic floor issues. I mean, there's lots of stuff out there, and it's maybe going to be tough to weed through. But they're out there for sure. Because believe me, there was 17, 18 million cancer survivors just in the United States. That you may feel like you're the only one, but you are not the only one. And again, your social worker or your nurse navigator may be able to connect you with some of these groups that you may not know about, take some of the legwork out of it for you.
And one of the amazing things is that there are so many virtual opportunities now. I mean, this virtual world has opened up, and I actually get information from like support communities like in LA, like for example, for Spanish speakers, that's the place to go, to those communities. So, just knowing that maybe online there are things that our other communities are doing, but they are available virtually. And so that is, and some of those really specialty groups, you might not find them in your community, but nationally, there's probably a group out there.
Okay. Well, Michelle, this conversation has been just fabulous and so helpful. Just first of all, to just validate that this is really, I don't think people really sit down and acknowledge how tough it is, because nobody's telling them it's tough. When you go through treatment, oh, it's tough, hang in there, you're so strong. And then nobody's telling you it's crap anymore, and you're like confused and dazed and nobody's helping you. So thank you for validating, and certainly thank you for educating, because that's what the recovery room does. So as my post question for you is, what are you going to do this week for your self-care?
So, and I'm always thinking about it. I'm a person who likes to try new things. And so recently I've really got into water aerobics.
Cool.
So it was something I never did before. And, I kind of learned a few things. One I learned is you can actually sweat in the pool.
Yes.
And the community, when I'm in this pool with all these other individuals, it is so much fun. So it's just something that right now is just, kind of like hitting the right spot with me. And so I'm enjoying it, and I'll probably try something new down the road too. But I like that idea of just discovery, of like being open to trying something you've never done before.
Yeah, I am a completely opposite. I'm a complete creature of habit. I stick to my lane, but I will certainly validate that because I have done water aerobics just because I need to know what other people are doing. It can be, again, you can be a light workout, a moderate workout, or it can be an intense workout.
Right.
It is really amazing the amount of effort and heart rate you can get. And I think it's really nice for people that have bone joint, weight issues. And again, there's so much, just let the water help. Even if you're afraid of the water's there to hold you up. It just does wonders. Well, Michelle, thank you so much for joining us today. I appreciate you and your expertise and your brain and your heart and your energy. All the information that we learned, Michelle's tips and resources will be in the show notes. And Michelle, we will welcome you back to the show in the future, because this conversation is not over. Great. Thanks, everyone. Bye.
Bye.
I love having you in my listener community. So if you haven't already, please follow and subscribe to The Recovery Room on YouTube and Facebook, and to the Recovery Room podcast. Please share these wonderful free resources with your support groups, family, friends, and medical teams. If you would like to interact with me one-on-one, as well as other incredible cancer survivors, please consider joining my cancer survivorship membership group, Recovery Room Plus. In Recovery Room Plus, you get access to in-depth cancer recovery info and experts, and engaging live events like yoga, book discussions, cooking demos, member meets, and more. I would love to connect with you. You can learn more at recoveryroomplus.com. The link is in the show notes. And here is your episode recap. In this episode, The Crickets of Aftercare, we discussed the challenges not often talked about in early survivorship, including the lack of coordinated care, a plan, or support structure. Cancer survivor specialist Michelle Kirschner recommended identifying your resources, holding on to or getting a physical therapist, and reconnecting with your primary care physician. Her 3 tips for early survivorship included: Number 1, advocate for yourself and identify, build, and maintain your support team as best possible, including your healthcare providers, your physician, your physical therapist, and social worker, or anyone else who will help continue to guide you. Number 2, movement is magic. Find ways to get active and stay active with family, friends, and other survivors. And number 3, connect with other people with similar cancer experiences to ensure you feel heard, validated, and understood in ways your support system may not be able to. And Michelle's 3 favorite survivorship resources include the My Cancer Crew app, the National Comprehensive Cancer Network guidelines for patients, and finding a virtual or in-person group that best resonates with you. Thank you for joining me in the Recovery Room podcast. Remember, exercise like your life depends on it, because it does. Let's talk again soon.